welcome everybody to our policy and research webinar, Reflections on Trans Health, Information, Updates and Outcomes from AusPath Conference 2023. I'm Ian Down, the Policy and Research Lead at LGBTIQ+ Health Australia, and my pronouns are he, him. LHA acknowledges the traditional owners of country throughout Australia, their diversities, histories and knowledge, and their continuing connection to the land and community. We pay our respects to all First Nations people and to elders past, present and future generations. I'm joining from unceded Gadigal land, and please feel free to use the chat function to share where you are today. So just some housekeeping. Before we begin, I would like to mention just a few housekeeping items. Our webinar today is being recorded and will be made available on the LHA website. If you miss any information, you will be able to find it there and go back and listen. After our presentations, there will be an opportunity to ask questions. I invite you to use the Q&A function, which for most Zoom users is located down at the bottom of your screen. Please feel free to ask questions at any time, and we'll come back to them after the presentations. And if anything in today's webinar raises concerns for you, support is available. You can contact QLife, which provides Australia-wide anonymous support for our LGBTIQ+ community. QLife services are free and include both telephone and web chat support. Call 1-800-184-527 or visit qlife.org.au. Okay, so about the webinar. The Australian Professional Association for Trans Health, or AusPath, conference was held from the 2nd to the 4th of November 2023 in collaboration with the Professional Association for Transgender Health, Victoria, PATHA. The conference theme was Advancing for Change, Advancing Best Practice. Today's webinar is an opportunity to hear about the conference from some of those directly involved in its planning and delivery. We will discuss the conference's key messages, interesting content, and new learnings. And we will then ask where to from here. So with us today, we have Professor Ashleigh Lynn, who is the president of AusPath and a professor at the School of Population and Global Health at the University of Western Australia. We also have Dr. Vivienne, who is the CEO at Transgender Victoria, a lead advocacy, education, and peer support community-led organisation and not-for-profit. Son has a background in academia and over 30 years experience in media production and a background in and research across digital self-representation, online activism, queer identities, and rhetorical strategies, feminist practices for speaking and listening across differences. We are expecting Dr. Thomas Drake Brockman to join us also. They are, I believe, very close by, and hopefully they will be with us shortly. What I might do is introduce Thomas when they actually join us. But I might go ahead and ask our first question to the panel, and in particular to Professor Ashleigh Lynn. So Ashleigh, which aspects of the AusPath conference were you involved with? What do you think were the most interesting and important sessions at the conference?
Hi everyone, thanks for having me. I'm joining you from beautiful Wajak Buja. And my colleagues who are just outside the door have decided that this is the time to do Christmas decorations. And they're talking very loudly. So if you can hear them and it is interrupting us, would someone please tell me, and then I can gently ask them to be quiet. So as the president of AusPath, I sit on the organising committee. So our organising committee was chaired by Julian Grace. And then we had organising committee members from Melbourne, but also from PATHA, from New Zealand, from Aotearoa. And I guess what I wanted to start off by talking about is some of the considerations that we took when we were planning this conference, because as far as I understand, it is, well, Julian said at the end of the conference, it's the most trans conference we've ever had, and I think most people would agree. It's also the biggest conference we've ever had, and I think that the things that we took into consideration when we were planning it are quite important. So I've just got some notes here. So I guess one of the principles that we took into consideration was community engagement. So that started off with the conference planner being a trans person, and that was really important because then the connection to the community was just even stronger. And Julian did a really great job of engaging people who work in trans health, cis and trans people across Melbourne to be part of the organising committee. And then just in terms of their knowledge of the community in Melbourne, was able to really link in with some brilliant panels. And I think that was part of the success of the conference. But then there are a lot of concerns when we're doing a conference like this, where we have a lot of people from community. And I guess it's important we need to think about the history of AusPath conferences, and that AusPath conferences started off as a group of medicos who met to talk about trans health, and their intentions were to do good for the community, but it wasn't community in partnership with community or community driven. And so that's the kind of context we're coming from. And we've got to a point in AusPath where in most of hi Thomas. We've got to a point in AusPath where we have a lot of trans board members. Our president, Clara, was a trans woman for a while. And so the whole dynamic of the conference has changed. So when we're considering how to plan a conference, we have to think about things like the placement of sessions, because we don't want all the clinicians to go to a clinical thing and then we have a community panel and then it's only community members, because that absolutely defeats the purpose of having clinicians really understand what community want and see. I think the other thing that we also have to remember, and this is something that's often forgotten in the media and people who kind of oppose gender affirming care, is that there are many trans people who are also clinicians. So, you know, it's about getting that balance really right. The other thing we had to think about was safety and making it a safe place for everyone. So things like language were going to be important. We had to have a code of conduct that people were agreeing to by signing up to the conference. And there were times where we actually asked the speaker there was one time we asked the speaker not to speak, because the language in their abstract, which had gotten through, really was going to be problematic. And we said that it could be uncomfortable for people. And it was a mutual agreement that it probably wasn't a safe space for the community or for them to be speaking. And those were kind of considerations. The other thing that we have to acknowledge is that conferences are really expensive to run. So not everyone can afford it. And unfortunately, that's just the way it is. We don't make a profit, or if anything, it's a very small profit. It's not the aim of the conference. And so we can't give free registration to community members. So I guess one of the things that we did around that is we had quite a lot of scholarships that were available to trans people. And also we had a system of pay it forward, where people could add a little bit of money onto their registration, which would allow additional scholarships. So that was some of the things that we were thinking about when we were planning it. I guess the other important part was about working with PATHA. So, this brought in a lot of consideration. So the first one was accessibility, because obviously it's more expensive for people to come from Aotearoa. And people probably don't know this, but having a fully hybrid conference costs about $50,000 more. And so it's actually really, really difficult to do. And so we had the Hoover app, and maybe some of the attendees who are online or in the panel can discuss the app. But what it allowed was that it wasn't all live, but that people were able to see the conference content except for the education day. And then the other thing that was important was making sure that we had the Aotearoa context, so that there was New Zealander kind of work that was represented, and that didn't get sort of fall off the agenda. And then also, you know, we talk about First Nations involvement. We had to remember our Māori and Pacifica content and our brothers and sisters there. So that was really important to kind of keep in mind. The other thing we wanted to do was really showcase a broad range of health contexts for trans people, which I think we did quite well, and I'm open to feedback, and I'd love people to tell me what they thought, but really kind of trying to focus on that intersectionality and how and the range of experiences that trans people have. So we had a panel on disability. We had a panel on trans people in incarceration. And we had quite a lot of First Nations content. And in regard to the First Nations content, it was really important for us that that was the opening of the conference. So we started off with the Walk and Cuddigen project, which is a study of LGBTQA plus young people across Australia, over 500 of them, run out of my centre in Perth. And the speakers spoke around the data from trans people there. And then we were followed by Felicia, who was from Aotearoa, who does a lot of work with Māori and Pacifica trans people. So I think those were some of the really important considerations. I think I'll stop there. That's kind of just what I thought of when I was thinking about how we planned this and what we needed to think about.
Thanks, Ashleigh. I just noticed that someone has their hand up, and I just wonder if we could keep questions until the end. So I wonder if perhaps if you have a question, if you could post it in the Q&A section, if that's all right, and when we'll come to it towards the end. Son, would you like to answer this question?
Ian, do you want to just introduce Thomas?
Shall I? Yes.
Yeah, because then we can flow straight from me to Thomas.
All right. Yeah, so welcome, Thomas. Thank you for joining us. I shall just introduce you. So Dr. Thomas Drake Brockman has recently been elected chairperson of Transfolk of WA, and you're also a freshly minted director of AusPath. When they're not doing one of those things, they're also a medical doctor at Albany Regional Hospital in Wardown, South WA, a researcher at Perth Children's Hospital, the University of Western Australia, and the Telethon Kids Institute, and also an avid tall ship sailor and a student pilot. So Thomas, the first question that we asked was, which aspects of the AusPath conference were you involved with, and what do you think were the most interesting and important sessions at the conference?
Oh, so it was actually my first AusPath this time, and so that sort of mix of researchers and clinicians and community that Ashleigh describes was something I hadn't experienced before, and that was incredibly striking. I was very happy that Transfolk of WA brought a few posters with us, and I spoke about one of our bits of work, and that was exciting. But other than that, I wasn't too involved in actually making the thing happen. Very happy just to have that amazing experience of the conference, and it's not like any other conference I've been to professionally, that's for sure. What I found most striking was just the quality and quantity of the Maori content from the delegates from Aotearoa, New Zealand. I think actually, if you compare that to what the Australian contingent produced, we might have a lesson to learn there. So that was an impression I got as well. And also there was just some new sort of intersectional minority areas within the trans community that I had not put my mind to thinking about a lot before. For example, those who are incarcerated population, very important. So it's nice just to have exposure to a whole bunch of other people who are thinking about different areas of the community that you might not have put your mind to in the past, and that was very thought-provoking.
Thank you.
I'll hop in now then. I've got a couple of notes just from sessions themselves that I went to, so some highlights for folks who were not able to attend. But I'll start with just echoing, I guess, this is my second conference. I was able to go to Darwin last year on Larrakia country, and I think considering Brenda popped in the comments there, you know, going back, it was very much about trans people rather than engaging with trans people who have lived and living experience, both as practitioners and as community members who are working in all the social and emotional support mechanisms alongside clinical pathways. And I feel that integration is just getting stronger and stronger. And I'd really like to thank Ash and Julian, and I see Vix in the audience as well, for the incredible volunteer work that you did to really centre some of those most marginalised voices, in particular the First Nations, the disability, the prison spaces. In fact, they're some of the panels that I went to, and I'll also echo Thomas, the presence of the Aotearoa contingent really highlighted, I guess, some of the similarities and differences between our countries, and, you know, some of the systemic obstacles that we can get tips and tricks from one another in terms of how to tackle it. But I'll also say the level of complexity of difficult discussions is much greater when you start with a group of people who are there for one another. And I'll highlight in particular, just because Thomas, you mentioned that one around the Aotearoa and First Nations in Australia. Of course, they have incredibly different lived histories and experiences of colonisation. And the fact that the New Zealand contingent were able to sing together in language, it was just, you know, it had bumps on, and we don't have that history where we had one language and one culture that was able to speak together. So some of the differences are also really important in terms of the kinds of ways of working with First Nations communities. And I really feel like some of the connections that for me came out of these spaces around how to work across, you know, really genuinely diverse cultures across Australia, 250 different language groups plus, and really different ongoing cultural experiences is one of the things, you know, I as a white person need to step into and you know, really commit to, and, you know, in particular at that intersection of gender diversity and First Nations gender. So I've got, I didn't get to a lot of things. I think, like lots of people at the conference, you know, you pick a mix of the things that you're interested in and the things that you feel like you need to be exposed to. And I know last year I very much had the experience of kind of being in the community strand and the practitioners were somewhere else. Whereas this time I think there was greater integration. And I think, again, as a trans person, let me acknowledge that even when you're in a room of affirming practitioners, it can still be very weird to be heard of your community as they, you know, it's kind of inevitable, and it's something you kind of have to step over and past. But I think that the presence and visibility of trans people in all of those rooms meant that there was less they and more discussion of we as practitioners and communities that could work together. It still is a very super intense conference because of, I guess, you know, because of that nexus. And I imagine maybe it's intense for practitioners too, because of the collapse of that distance. You know, there's no safe gap where you can shut your clinic door and go, oh, well, now I'll go and debrief with my other practitioners, because you're surrounded by trans folk during the breaks. And a lot of those conversations in the breaks were where a lot of really intense stuff was happening. So I'm not going to do level of detail, but the first workshop that I went to, which was day one, in my humble opinion, the day before the conference start, was called Beyond the Clinical. And we had the honour of meeting Jennifer Shields then, who's the PATHA president. And turns out we met in an academic conference 15 years ago in New Zealand and have since gone on our trans journeys. So that was also very affirming and lovely. Hearing some of the things that Qtopia are working on in terms of peer support and kind of really intentional wellness packages combining peer and psych well-being approaches for trans folk was really inspiring for me in terms of my role at TGV. I think that's very much the direction we're going in terms of warm referrals across systems, and really acknowledging that it's only a small percentage of trans people who are on a medical journey. And, that's the tip of the iceberg. A lot of other people are either on their way to a medical journey or are just seeking social affirmation and social connection in their gender diversity. So that really much more holistic kind of understanding of, trans journeys not just being a clinical process, really, like that's a stunning thing to see happening in what is primarily a medical context. That's the purpose or history of the conference. But I see a real expansion into that space of emotional, social well-being beyond surgery and hormones. So that was interesting to hear that reflected back in the New Zealand space, along with all of the endless work that they are also doing, advocating for systems change. And I think we heard, some of that system says no, computer says no kind of discussion that we have around non-binary gender identities as well, and really got to get into some of the very practical and pragmatic navigations around those systemic problems that are continuing across both countries. Of course, there was a panel of peer navigators and peer supporters in that pre-conference space. And so that was incredible to hear, the value of their work in terms of working with trans people as a trans person and the opportunities and challenges that come with that. I've actually just come from a first community of practice for peer navigators that we're starting in Victoria, and feel, after AusPath, that there's a real possibility of expanding beyond or paying forward, some of the things we're able to facilitate and host in a Victorian space to engage with peer navigators in other states. And, ideally, if we can get our time zones together, can we get Aotearoa and Perth together in the same room at some time to... but there was just some real, goosebump kind of moments there in hearing people speak about the privilege of having their lived experience centered in ways that they could pay forward to community. And, I guess in a perfect world, have that feeling that it's getting better and easier, and they can support younger people and older people as they're coming through their gender journeys. Again, programmed on that same day, so may well again be a Vic/Julian programming coup. The First Nations gender diversity space that day was fantastic. Some of the things I took away from that I've highlighted is, the value of co-design, and we really got into what that actually really means as ongoing learning throughout a process, not just a little funded consultation at the beginning and then maybe some feedback down the track. But the real centering of co-design throughout the structure and design of a program. And then in this space, there was some fantastic, really complex discussion around gender roles and naming of gender roles in different cultural, historical spaces where, there might be a hierarchy of power in a community, but the roles themselves have value and significance beyond the gendered nature of them. So there were some things here that I think, these are just incredible openings of our understanding of binary gender roles that we can learn from First Nations cultures and histories and experiences. And, they're sometimes hard to talk about. So it was good to have that space. I took away from that a real desire to curate a intergenerational and intercultural storytelling program whereby people can actually, really intentionally connect across differences, but being in ways that can support one another. How am I going for time, Ian? I've got another couple of...
Well,
yeah.
Might go to the next question, because you're actually already
I'm probably covering some of the answers.
some of that, because the next question is, in what ways do you see the current trends or innovations discussed at the conference influencing future practices or policies?
I might pick that one up just because I'm on a roll, and then leave it to Ash and Thomas to flesh out as well. Further along in that discussion of Computer Says No, I think the non-binary panel were just incredible. And I see this as, the future kind of top level complexity of gender diverse care. Because there's no such thing as one size fits all. All of the panelists in that space spoke about how they'd been guided by their own instinct in terms of working out where they wanted to be, and that it was a very live, ongoing journey that had taken, in some cases, many years. And, we still have a mainstream narrative around passing, and that's a very binary understanding of fitting into a masculine or a feminine gender presentation. And we still have a mainstream narrative around making up your mind as if it's a finite thing that you'll settle on and then you'll never change again. And I think that those two things in the non-binary space, the fact that identity in and of itself is fluid and changing over time, and that your needs change over time, is something that fundamentally we are not seeing well reflected in systems or services. I think we're getting there, and the discussion was adequately complex to understand and accept and affirm, that non-binary complexity. But I was very conscious that we're in an AusPath bubble of people who, already get transgender diversity, and therefore are primed and ready to understand genderqueer and gender fluid and all of the other ways of being non-binary. I'll stop there. I'll come back again. I've got disability in prison still on my list, but Ash and Thomas, if you want to get a word in edgewise, you better go for it.
I'm happy to talk a little bit about this. So I guess in terms of, how this influences policy and practice, I guess one of the things that I'd like to see is AusPath leading the way in co-leadership with and that our ability to, the way in which we work in partnership with trans community, and it's it's not us and them as much as we can do that, is to set a good example for the rest of the sectors. So I hope that we can see that kind of flow into more into policy development and clinical practice, and I think it does in some places, but it's certainly not everywhere. The other thing that I think, what I noticed at the conference was by having this Hoover app that we used, there was a lot of sort of peer. There was a lot of I'm trying to think of the word, sort of impromptu link ups that happened. So, for example, people who are neurodiverse who didn't want to go to the disco dinner thing, there was a group of people who said, well, they just organised to go for a walk in the park.
Mm.
And so that kind of impromptu sort of linking up of people. But I think what it also did was it linked up people with professional interests. And so, for example, we saw the development of an eating disorders interest group. And so I hope that's going to flow onto AusPath, where we're going to see that there are more special interest groups that are associated with AusPath, and we can help link them up and help provide the infrastructure for them to meet. And that's useful for so many reasons in this little community of practice. The other thing, and The other thing that I guess Son will probably talk about this a bit more, just because we had a bit of an experience there with this particular paper, but what we're starting to see now, and I'm going to talk here from my professional sort of research experience, is that what we're starting to see in the pediatric space is that data that we really need to demonstrate that gender affirming practices in children and adolescents in Australia are beneficial. We all know that they are, but really we've lacked the Australian data to show that. And so one of the papers that was presented was from the Gender Diversity Service in Perth that showed that the rate of re-identification with birth-registered sex is next to nothing. And that was a really important paper in terms of its contribution to the literature internationally, but also to the way that we can defend the practices that are occurring in Australia. And I feel like we're starting to see a lot more of that stuff coming out from the scientific research happening in Australia. And that's really important for the paediatric and adolescent services.
Yep.
That's all from me. I'll let Thomas talk for a bit.
Yeah, thanks, Ash. I actually want to pick up at this little thread of this this sense of being odd, being in a room and hearing yourself talked about as they or them, as opposed to we or us. And as a person who is a member of the trans community and is also a clinician, I'm not a clinician that practices particularly for trans people, but I am a doctor, and therefore I'm also one of them from the community's point of view. And I certainly know there's lots of spaces where I've done some work previously looking into sort of healthcare for trans people, and not always been sort of advertising doctor with flashing lights and sirens. And you certainly, people relate lots of things to you about, those people, or, in the healthcare settings. And so I think it kind of goes both ways. And I think obviously healthcare professionals inhabit a certain kind of privilege in our society, and in a space like a conference, it's a sort of a space that lots of health professionals are pretty familiar with navigating. Though this conference is perhaps less familiar with navigating this particular one for some of them. And so that experience of saying, oh, okay, this space is not just about me, is a shared experience, I think, perhaps experienced in different ways, or, unequally, but it's a shared experience, and it's actually a really valuable experience to share, I feel. And I think, the most exciting work really is working at how we come together and share these spaces, and then eventually collectively talk about us, that being the group of people who care for there being better practice in trans health in Australia and ultimately the world. But it certainly is an interesting experience. I think actually quite important, quite valuable to sit with the idea sometimes that you are not necessarily your patient's best friend when they think about which groups of people they feel really supported by, and which groups of people they don't feel ever place barriers or see them in a way they don't want to be seen. And I think the community, and vice versa. So I think that's really interesting. And, there's a growing tendency in all of health service planning, it seems, to talk about things like co-design and consumer involvement. It's, as far as I can tell, basically mandatory to get any decent sized grant these days. And even, just looking at, like Western Australia Health, WA Health, they are doing more and more work in this space, putting out more and more resources. And I think, perhaps even cardiologists and people with heart disease have a relationship which is not entirely perfect, shall we say. So I think it's only natural that that health professionals and those who they provide healthcare to, it's not about saying yes to everything, but it's about finding ways to understand each other and to understand each other's good faith as well. So I think, it's an area where policy is already changing. And I think events like AusPath only sort of supercharge the ability for trans health to adopt those practices moving forward as well. So
Can I
that's the
jump in
thoughts.
there just to add to that, Thomas? Because I think you've
Yes.
made such, sorry, Ian, I'm taking over there. I think it's a really, really interesting point. And I think that, you know, it's complex because also a lot of those clinicians are people's, like doctors, or and they're seeing their patients or clients. And so it's even more complex. But one of the criticisms of AusPath that comes from the haters is that our board is majority trans, or that one of the comments on the conference was that it was more trans people than clinicians. And we're very proud of the fact that we have trans people who are also working in this space. And I think what people forget is that the people who come to AusPath, the people who are members of AusPath, work in healthcare, regardless of whether they're trans or not. They work in trans healthcare. And in that way, it really does become the us.
All right.
Go on, Ian, do you want to ask?
No, please go ahead if you had something.
I think we're on a roll now, so no stopping us. I just want to also highlight how difficult that can be, because we are basically building on very unstable foundations of historical trauma. You know, for trans people, it has always been well, okay, I'll reframe that actually. For trans people who wish to go on a medical pathway, there's been the role of gatekeeping by medical service providers. And to some extent that still exists. You know, there's the frame of your best interests, and it's all about, you know, how much autonomy and understanding you're assessed as being able to have as to how much you can direct your own journey. But it's still in collaboration with somebody who can say yes or no to giving you hormones, or to giving you the surgery that you have you know, chosen to pursue. And that trauma, combined with the mental health presence and space, you know, like I said to you earlier, I was subsequently spending a week at the coronial inquest into a cluster of transgender suicides. You know, the difference in terms of complexity and understanding of complex health needs that we can have in a space where we agree that gender diversity exists and that affirming care is better for everyone is night and day contrast to the discussion that we're having out in mainstream media, and to some extent in, you know, outside of the urban bubbles of our states. I don't think that we have the kind of universal understanding or support across regional and rural areas that we need. And I think that same lack of awareness is evident in a lot of the intersectional spaces where, you know, domestic violence, homelessness, education, anything where the trauma is upped, the understanding is also down. And, you know, there's obviously a correlation between those things. But the prospect of actually, you know, bringing people together as a community, as you said, Thomas, to work towards a community where we've got a group of people who are talking about us as, you know, the common well-being of trans people, it's always going to have those trauma scars and roots that are just under the surface, and they will surface at some point during the conference and in ways that can be really hard to make safe enough to keep going. So I think that AusPath, you know, it's very evident the amount of care that is going into accessibility, and I don't think you actually can guarantee safety for everybody, because everybody will have times when they're feeling uncomfortable and triggered and they need to be able to go away. And there was a nice quiet space that was available for quiet reflection, and I actually was witness to somebody getting kicked out of that room because they were trying to use it as a conference call space, and that's not the purpose of the room. So, you know, there's that navigation of those boundaries around acknowledging the trauma and the complexity of the world we continue to live with, hoping that we're on the same page in terms of goodwill and a common trajectory, and, you know, having enough faith to be able to listen to one another. That in some cases means that we're able also to talk about the complex spaces of things like detransition, you know. And I think the fact that actually, not only do we have data to say that it's like a very, very small thing, we also have compassion in a way that means that, you know, if you're actually not happy with where you are, that's okay. And you deserve good care and, you know, wrap around the whole gender journey. So it takes the fire out of some of those mainstream discussions that, yeah, Ash and I were having, you know, in parallel to the conference with a journalist for The Age.
Sorry, I'm just going to add to that, because one important point was the journalist was really sneaky and snuck into one of the talks. And his impression was like, wow, look at all these amazing people who care so much around trans health, because people don't see us en masse. And for him, that was really quite profound to actually see how many people really care about this around trans health.
Yeah, it really puts in proportion that balance around, you know, some people have some concerns and, oh my God, there's a whole world of people who actually are here, you know, to do good.
Right.
You wouldn't think it would be that hard, but there you go.
All right, just thinking about time, we might skip to the final question, and just noting that at this stage there are no questions that have been submitted. So please, if anyone has any questions, please do submit them now. So yeah, just as a last question, and if I could just have some brief answers, please. I'd just like to go to each of you and ask, what next? So from your reflections on the conference, what do you think are the most pressing issues between now and the next conference? Where should the sector be focusing its energies for action?
Does someone else want to go first on this, please?
I'm dubbing you in, Thomas.
I'm happy to pitch in first. Look, I think that making sure that we ensure that the work that's being done in the area does its utmost to represent a whole range of trans people is really important. I think it's, you know, and we have seen this over the last sort of few years as we've evolved from sort of talking about what you might sort of call binary trans people through to sort of taking a broader lens at gender diversity, expansive gender, you know, and diversity in a really umbrella way, making sure that we're including non-Western ideas about gender in that umbrella as well. And I think, you know, this conference has certainly shown me some things about how that discussion's happening in Aotearoa, New Zealand. It's very exciting. I think we are beginning to have that conversation in Australia, but there's certainly areas of challenge there. Some of it's just around working out, you know, some sets of words to use in research, you know, like working out an ontology. So when we say, you know, we have a population of people and we feel we need to count them to demonstrate what the diversity in the population is, well, which categories do we use? You know, are we allowed to use categories, or do we, you know, use some other sets of measures? There's lots of fun stuff to be had there. I think in the context that I exist in as well, which is a medical and therefore a medical legal context, I think the more that we can sort of agree across country or countries about what is good, standard, well-informed, appropriate care, and do so in a way that is acceptable to community is really important, because we are beginning to see trans health become more mainstream, which is fantastic. But that also means that we need to make sure the resources that underpin delivering that care are targeted at a mainstream medical or mainstream health audience, I suppose. Easy to pick up, easy to run with, and sort of very clearly and obviously the right guideline to follow and endorsed by all the right people. So there's a whole lot of work there. And I know that AusPath, in its non-conference, you know, in its sort of capacities organisation, does a lot of work around that as well. So I think those are some of the key priorities for me as a member of the community and a clinician and a researcher, though my research is not in this area. But I can sort of appreciate from a research lens that, just knowing how to talk about a population in a way that is appropriate population, but also is clear and accurate and allows you to compare and contrast different data sets is really important. And from a clinical point of view, just saying, here's a guideline that is going to help you be safe for you and for your patients and for the health system. It's going to make it really easy for people to get on board with delivering high quality, safe trans healthcare.
Thank you.
Son, you can go.
Yeah. I'm just looking at the chat too. If anyone is interested in connecting with the community of practice that I was talking about for peer navigators, just email me at son@tgv.org.au or kerry@tgv.org.au or both. Which is actually, I think, the big thing for me coming out of this space. There's a question around, I think, yes, agreeing on research ethics and good, compassionate, caring practice. We do still have to argue for that. It's not a given. And as I said, the difference between, being in a space with affirming practitioners talking about complexity rather than being in a space where you've got some people saying, no, you don't exist and you shouldn't have care at all, versus other, investing more energy in that so-called balanced discussion, I feel, is increasingly a waste of our time. I think there's a small minority of people who are massively amplified, and we spend a disproportionate amount of our energy actually meeting their needs rather than talking about our own. So I will say just the need for, yes, we do need mainstream medical services, but we also need specialist LGBTQI plus community-led and owned and run services. And I'll add to that the social support and the peer support stuff that really wraps around and holds the big picture together. So for me, there's a prospect in AusPath now where you can kind of step outside of medical approaches to trans and gender diverse health to how do we be great in the world and how do we be a part of that for one another. And to me, that stuff is about connecting across our regions, because it was very evident that people are working on an amazing range of projects across the country and Aotearoa. There's a network of people that we can build and leverage to cut through some of the just getting things going kind of momentum that we've always needed. As it coming from a small not-for-profit, we still don't have core funding. It's a perpetual how do we keep going, and if we can draw on the strengths of other organisations who've survived for longer and have been around for longer and have broken through into some of the corridors of power, then we can learn from them, but we can also pass along to other orgs who are wholly volunteer-led, because there's a place for all of us and we need all of us. And yeah, I think AusPath's really an important part of the picture now in terms of supporting that infrastructure, as are LHA. So, back to you, Ian.
Want me to talk quickly, Ian? So, the future, I could talk from so many perspectives, but I'm going to talk from the AusPath perspective because I'm here as the president. And in doing that, I'm hoping to answer Brenda's question about the need for culturally safe mental health support. So AusPath is now the biggest it's ever been. So we have over 500 members, which is huge. And what we're seeing is a lot of people who've never specialized in trans health or really done much in trans health, joining to try and learn and seeing the need and really wanting to be part of this. And so I'm hoping that as we continue to expand, and I feel like we will continue to expand, that we will be able to increase that culturally safe workforce. And as Son said, having those communities of practice that can really guide people to be delivering gold standard best practice care. The other thing that we need is a longer conference. So we've only ever been 2 days with brilliant education day, and that's a shout out to Vic and Joe. But I think we do need longer because we can't accommodate everything that is offered up for the conference. So we'll be discussing whether that's going to have to be a possibility at the conference in a couple of years. The other thing is just in terms of AusPath's priorities from what we want to work on. I think that Son and Thomas have touched on two of the things that we need to be thinking about. So one of them is always the inclusion of broader gender diversity and moving outside of the binary of trans identity. And interestingly, you know, I've been on the board long enough now to be on the second conversation about language, which is really important because I remember this massive conversation about what we call the organisation and how we refer to trans, and it's happening again. And I think that's really important because language changes and we need to keep up with that. The other thing that we're really focused on is trying to welcome people who are no longer identifying as trans or have re-identified with their birth registered sex. I think that's a really important aspect, and you know, there is some stigma, and we're trying to break that down. And as Son said, just ensure that everyone understands that it's part of a journey, someone's gender journey, and we should welcome people back into the community. I'll stop there.
Thank you, Ashleigh. And we do actually have a question that has been submitted. It's targeted. It's posed to Thomas, and I'll just read the question. But we're very short for time at the moment, so perhaps Thomas, if you could, just answer quickly. So the question is: since Thomas mentioned the inclusion of non-Western ideas of transgender health, I would like to know more about this. How do you think different cultural backgrounds can be more inclusive of transgender people, given the stigma, which is a massive barrier to this? And as a follow-up, do you feel that there are already clinicians from non-Western cultural backgrounds that are inclusive of or part of the LGBTIQ+ community?
Yes, there's definitely people who are members of the community, but I think an obvious and an important example is to talk about gender in First Nations cultures in Australia, which is not necessarily aligned with Western ideas of male and female gender binary. I certainly am not an expert, but I think most people working in this space in Australia would be familiar with terms like brother boy and sister girl. Interestingly, though, I'm aware of some work out of the Telethon Kids Institute in Perth, which says that quite a lot of young First Nations mob who identify as trans don't identify with those terms.
Yeah, most are not identifying as sister boy, brother girl.
Yeah. And so I think, as people trying to be inclusive in this space will try and use those terms, but actually, should we be doing that is a really good question. And it's a question we need to actually go and find an answer for. And, you can hypothesize why this might be. There has been a fair bit of Christian missionary behavior in Australia towards First Nations populations. Have we gone and sort of, killed off some of their cultural ideas around gender? And now the young people are rediscovering their own ideas about what gender might mean for them as First Nations trans mob. So that's just one example. In terms of people working in the space, I certainly am very happy that in Transpac WA, I have a staff member who helps run our youth space who's a person of colour, and they certainly make a point of raising with me, and I welcome the input that some of the language we use around gender diversity can seem very Western, and so we do our best to navigate that space. But I think we need to know more. I don't have the answers. I don't think anyone really has the answers, and so work like Walk and Cuttergen out of Telethon Kids Institute is really interesting, and I'm paying attention to it very closely. That's for sure.
All right, thank you very much. And that brings the discussion to an end. So I'd just like to thank the panelists, Ashleigh Lynn, Son Vivienne, and Thomas Brockman. And I'd just like to invite people to complete the brief survey, which I've just posted in the chat. So if you click on there, you'll be taken to a survey where you can tell us about other topics that you might want to see covered in future webinars. The next webinar will be held on the 31st of January, and that we will have Professor Jane Usher from Western Sydney University talking about cancer screening among LGBTIQ+ people. And just a reminder that there is support available at QLife. So should something have come up over the course of this discussion, and you can contact QLife on 1-800-184-527 or visit qlife.org.au. And yeah, so just again, thank you to everybody. It was a wonderful discussion. Great to hear about all the richness that came through from the conference. And yeah, thank you very much for your time.